Hello everyone, welcome back to another recall session. So today we're going to discuss with you about anatomy recall questions of NEET-PG 2020. So let us start with our first question. Which of the following forms the lateral boundary of the anatomical snuff box? For lateral boundary of anatomical snuff box, you have to remember ab pile. So ab pile is the lateral boundary of anatomical snuff box, means abductor, pollicis, longus. An abductor pollicis longus is here, an extensor pollicis brevis. So the answer here for lateral boundary is A. Extensor pollicis brevis and abductor pollicis longus. Let us move on to the next question. Identify the cell marked in the histological image of the cerebellum shown below. So these cells are actually the Purkinje cell. Okay. They arises in the Purkinje cell layer and they relay their exon into the deep nuclei of cerebellum. Okay, so the answer here is A. Purkinje cell. The next question is, which of the following is not used for the identification of the facial nerve trunk? Retrograde dissection from distal branch. This one is absolutely true. The second option is tragal pointer. This one is also true. Third one is inferior belly of homohyoid muscle. So this one is false actually. And the last one is posterior belly of digastric. This one is also true because superiorly to the posterior belly of digastric, facial nerve is located. Okay, so triangle pointer, retrograde dissection from distal branch as well as posterior belly of digastric. These three are the anatomical landmark for the facial nerve. But inferior belly of homohyoid is not the correct answer because that is not the true landmark for identification of facial nerve. So the answer here is C. The next question is false statement about fetal circulation is the anatomical closure of foramen ovale is by 3 to 5 days. This one is false because anatomical closure of foramen ovale is done by 1 month to 1 year time period. So anatomical closure happens from 1 month to 1 year time period. So that is a wrong statement. The anatomical closure of ductus arteriosus is by 3 to 7 days. This one is true. Right umbilical vein is absent. Yes, left umbilical vein is left behind, but right umbilical vein is absent. And anatomical closure of ductus arteriosus is by 2 to 3 weeks. This one is also true. So the answer here is A. Anatomical closure of foramen ovale is actually done by 1 month to 1 year time period, not in 3 to 5 days. The next question is a tumor of the uncinate process of the pancreas affects which of the following vessels? So tumor of uncinate process of pancreas actually affects superior mesenteric artery. So the answer here is A. Because the superior mesenteric artery passes in forward of the uncinate process of the pancreas and tumor of the uncinate process of the pancreas move forward and compresses the superior mesenteric artery. Next question is A patient is presented with clinical features of ataxia and incoordination. This is due to thrombosis of which artery? Ataxia and incoordination actually happens by superior cerebellar artery. So the answer here is D because this is the symptoms of cerebellum. So ataxia is there, incoordination is there. These are all the symptoms of cerebellum. So cerebellum symptom and defect is superior cerebellar artery. Okay, there is ataxia and incoordination is seen. The next question is which of the following structures prevents the upward extension of thyroid swelling through its attachment to the thyroid cartilage? So actually sternohyoid and sternothyroid are two muscles which actually prevents upward extension of thyroid swelling through its muscle attachment. So the answer here is B, sternothyroid. The next question is a patient presented with the extension of the metacarpophalangeal joint and flexion of interphalangeal joint. Which muscle is affected? So this is showing the defect at dorsal digital expansion, and this is mostly due to lumbricals and introsi muscle defect. So the answer here is B, introsi and lumbricals. The next question is meiosis occurs in. Meiosis occurs in adult ovary. We already know the oogenesis process, where the meiosis 1 and meiosis 2 process is involved in formation of ova. Okay. The next question is long left recurrent laryngeal nerve is due to the persistence of which arch artery? So during the process of development, so laryngeal nerve that arises below the sixth arch artery and it innervate intrinsic muscles of larynx. So long left recurrent laryngeal nerve is due to persistence of sixth arch artery. The next question is the muscle marked by the arrow in the image below is innervated by the muscle marked is levator scapulae, which is supplied by dorsal scapular nerve. Answer here is dorsal scapular nerve. Next question is the patient presented with weakness of the right side of the face with the loss of pain and temperature. Pain and temperature sensation of the left leg is also lost. The lesion is most likely located at. So the clinical scenario is suggesting that weakness of the right side of the face with loss of pain and temperature. So the ipsilateral Facial palsy. And pain and temperature of the left leg is also lost. So the contralateral leg sensation is gone. The lesion is most likely located at. So this is suggestive of a scenario of lateral pontine syndrome. So lateral pontine syndrome is due to the affection of lateral pons. So the lesion most likely located at lateral pons. So the answer here is B, lateral pons. The next question is ligation of common hepatic artery will impair blood supply in. So guys, to answer this kind of question, we have to know the vascular anatomy of the liver very well. By this only we can conclude and we can came into the conclusion of what are the actual branches of common hepatic artery and in that the blood supply actually happens, and when you ligate common hepatic artery the blood supply in that branches will become impaired. So from these all options, two branches are right gastric and right gastroepiploic artery, which are the branches of common hepatic artery. And when you ligate common hepatic artery, that will lead to the impairment of blood supply in the right gastric and right gastroepiploic artery, because these two are the branches of common hepatic artery. So the answer here is A, right gastric and right gastroepiploic artery, because these two are the branches of common hepatic artery. We have to know the blood supply, we have to know the vascular anatomy of the blood supply of the liver as well as stomach, so that we can easily answer this kind of question, and this kind of question becomes a cakewalk. So the answer here is A. Let us move on to the next question. The type of joint marked in the image below is. The joint marked in the image below is costo transverse joint. That is actually the synovial joint. The answer here is D. The next question is identify the sign shown in the image below. This is actually due to rupture of the tendon of long head of biceps brachii, and that is known as Popeye shine. So the answer here is A, Popeye shine. The next question is a patient presented with an enlarged inguinal lymph node. The most likely primary cause is. So the enlarged inguinal lymph node is most likely due to seen anal cancer. So the answer here is B, anal cancer. The next question is identify the type of cartilage shown in the image below. So this cartilage contains small group of chondrocytes which are surrounded by type 2 collagen fibrils. So this is seen in elastic cartilage. So the answer here is B, elastic cartilage. So with this, we complete our recall session. Thank you so much for watching and see you in the next one.